Called the picks and shovels providers.
New drugs called agonists, they're reaching about 15 to 20%. And that is what makes them.
Well, I think healthcare is an interesting sector for us because, in our process, we're looking for companies that have strong franchises that are experiencing positive profit cycles. And within healthcare, you find a number of solid franchise positions. So companies that have intellectual property protection or strong brands or leading market share positions. We always say that where there's innovation, you tend to find profit cycles. And clearly there's a good amount of innovation throughout healthcare. Add that to the fact that there's a limited amount of economic cyclicality within healthcare spending. And it tends to be a pretty reliable area for us to source new investment ideas. I'd say we learned a long time ago what we're looking for to be successful within biotech. First, we had to learn what not to look for. We try to avoid really early stage biotech companies that we refer to as lottery tickets. So companies that have one drug in clinical trials. If the trial works, the stock's going to be up a lot. If the trial fails, the stock's going to be down. We don't consider that a franchise. We're looking for companies that have a de-risked asset. So an important new drug that is approved or about to be approved and has a very nice adoption curve ahead of it. And then behind that de-risked asset, we're looking for a company with a portfolio of additional R&D projects with a lot of long-term promise. A company that also has the management strength to lead that innovation and the balance sheet that gives the financial resources to fund all that investment. And we found that with a long patient holding period, that set of characteristics can work really well for our process.
Yes, biologics are complex and large molecules. Increasingly, scientists are finding the proteins or the cells that are driving diseases inside the body through molecular analysis. And biologics are the molecules that target these very, very specifically. They go after proteins and they go after cells, piggybacking basically on what our immune system does. Biologics are super difficult to make. You need to engineer cells or living organisms to make them. So the process to make them is expensive and super finicky. Any changes to this process can actually make a completely different molecule. It's normally an expensive treatment. It generates very, very high margins, and the innovator who created the molecule enjoys a much longer life, a commercial life, because there are so few competitors that come in behind.
Well, the growth in biologic drugs creates big opportunities for what we call the picks and shovels providers within biomanufacturing. So the suppliers that provide the specialized reagents and equipment and the outsourcing services that help biopharma companies manufacture these very complex therapies. Increasingly, biotech companies, certainly the smaller ones, but even larger ones, are looking to outsource more of that production to specialized service providers. And I think they're increasingly reliant on the suppliers to the industry to make this manufacturing process more efficient and reliable. That's great for the companies, and it's also a nice opportunity for investors, I think, to participate in the growth of biologic drugs in a much more diversified way than taking big clinical trial risk with individual biotech companies.
Weight loss drugs for the first time are reaching the level of weight loss of the more invasive procedure called bariatric surgery. Bariatric surgeries cut the weight by about 25%. These new drugs called GLP-1 agonists, they're reaching about 15 to 20%. And that is what makes them very, very exciting. In addition, it's not just weight loss. They have other side effects like reducing glucose in diabetics or improving cardio function and reducing heart attacks in patients. So there are other benefits that you derive from these molecules. The U.S. has about 40% of the adult population is obese or overweight. In 20 years, it's going to be 50%. Obesity is growing around the world. It's a problem for health systems because it drives hypertension and it drives heart attacks, sleep apnea, cholesterol. So it's high cost. So we believe that the health systems are going to increasingly pay for weight loss drugs. And some analysts estimate that the category could reach up to $50 billion in sales.